Very good day to everyone. I'm Dr. Lim from Missi Care, and welcome to our Missi Care Online Health Talk. Today's topic will be women hygiene care in conjunction with the International Day for Women Health. And you'll be surprised why nephrology is talking about women health. Because we had one project talking about women health. So I will take opportunity to share with you about how to look after a woman hygiene. And because it's such a vast topic, but we try to focus on a few important topics, and in particular, three diseases that commonly affect women. All right, let's start. Now, the common female genital symptoms, they are usually itching, vaginal discharge, foul odorous discharge, pain during sexual intercourse, and pain when passing urine. These five are the commonest one, and there are various factors, but we just focus on a few. And the most common disease that affect vaginal problem will be yeast infection, and trichomoniasis, and also bacterial vaginosis. And I'm sure a lot of people don't understand or don't usually hear about bacterial vaginosis, which I will try to elaborate further. Now, we talk about yeast infection. It's one of the commonest infection in women reproductive tract. It's caused by the fungus called Candida. And it's so common that it can actually found in a small amount in the normal woman vagina and without causing much problem because it can be so-called the normal flora there. However, there are certain conditions that increase the growth of the Candida and hence causing the symptoms and problem and become a disease, right? When the yeast multiply in numbers, then become a vaginal candidiasis. And it happens when a patient or person have been on prolonged antibiotic or strong antibiotic that kill the normal flora and let the candida grow in the vagina. Or during pregnancy time, because of the hormonal change, it will change in the pH as well. It will cause the overgrowth of the candida. Birth control pill is known to cause this problem as well. And like for example, when the immune system down, like in diabetic patient, one of the common presentation for a newly diagnosed diabetic will be candida for female, right? Weak immune system, like for example, those patients on steroid, immunosuppressive patient, transplanted patient, and certain disease affect the immune system, they tend to present with the candida as well. And even just for stress, from the stress, it will cause candidiasis in the vagina. And it's so common that it's stated that 3 out of 4 women have at least one vaginal yeast infection during their lifetime. And nearly half of women have 2 or more episodes of the vaginal candidiasis. All right. And what are the treatment? And usually, we have got topical vaginal pessary that inserted the vagina for 3 to 7 days, depends on the brand and the type of the medication, antifungal antibiotic. And if a severe fulminant disease, we may have to use the tablet, oral antifungal tablet. And sometimes the vaginal candidiasis must spread out to the skin layer, involving the vulva. Then we may have to prescribe topical cream for the vaginal candidiasis at the vulva area as well. Now, next topic, we want to talk about trichomoniasis. Trichomoniasis actually is a parasite. It's not a fungus, it's not a bacteria, but it's a parasite. And spread through unprotected sex is one type of the sexually transmitted disease. And is one of the most commonly curable sexually transmitted infection. And it can spread even lady doesn't have the symptoms. And the difficult part to treat and the diagnosis, incubation period may take from 5 to 28 days. And high risk of getting HIV as well if exposed. And treatment, of course, is antibiotic. We call it metronidazole. We specifically use to treat parasite. And the treatment successful rate is very high. And again, it's a sexually transmitted disease. Prevention is still protective sexual intercourse. Now we talk more on the bacterial vaginosis because it's one of the commonest problem that we encounter and then by female. And a lot of time, because of the shy embarrassment, they try to hide it until quite late stage. It's most of the most common cause of vaginal discharge in women during their reproductive years. It's not really an infection per se, but it's the off balance of the organism, good and bad organism in the vaginal canal. It happened with BV, or we call it with bacterial vaginosis, happen when the normal balance of the lactobacillus, which is a good bacteria that colonize the vagina, gets thrown off or off balance by the overgrowth of other bad bacteria. Now, lactobacillus sounds very familiar. Yes, correct. It's commonly found in the normal gut, and the gut intestine will have a balanced growth and colony of the lactobacillus to help us digestion. That's why, like Vitagen, they have a good lactobacillus to help our gut healthy flora. And so, as a vagina, we have this good bacteria called lactobacillus as well. Now, what are the risk factors that cause the imbalance of this normal bacteria and overgrown by the bad bacteria? Usually, it's sexually related. For example, a person have a new partner or have practicing multiple partners and being pregnant and using vaginal douche. We always advise female not to douche the vagina because you will push infection into the urinary tract and also pelvic inflammatory disease as well. Having an intrauterine device, some ladies use IUD for their contraceptive purpose, and that's then a risk of the VV as well. And of course, as I mentioned earlier, unprotected sex also increase the risk of a VV. And how common it is very common. Look at one of the study in United States estimated that 29.2, close to 1/3 of the women within the reproductive age 14 to 49, right, will have this problem, BV. And then worse is 84% of them reported no symptoms. Why is so important? Of this 84%, no symptom doesn't mean that doesn't create complication in much later of their life. I will tell you about the complication later. Women who had not had vaginal or oral or anal sex before still can be affected by BV, about 18.8% of them. And then prevalence of a BV increased based on the lifetime number of sexual partners. So what are the complications? Why I mentioned that just now? 84% of them no symptom is of concern because without symptom, they don't know that unaware that they may lead to certain complications such as when they deliver, they're pregnant and then they have some eventful pregnancy, for example, premature deliveries, low birth weight babies. And then, of course, they are more susceptible to sexually transmitted infection because the defense system in the vagina has been compromised, such as HIV, herpes simplex, chlamydia, or gonorrhea as well. After the surgery, gynecological surgery, this group of patients tend to have infection risk as well. And all this infection in the long run may lead to pelvic inflammatory disease, which is the infection over the ovary area, over the cervical area. And this, everyone knows that PID, pelvic inflammatory disease, increased risk of infertility. And not only that, it also increased risk of ectopic pregnancy as well. Now, prevention is better than cure, as doctor always say. So how to prevent it? First, we know that it's very well known that it's a sexually related disease. So again, safe and protected sex is the most important thing. As I mentioned earlier, this happened when the normal flora of the lactobacillus outthrown or killed or overgrown by the bad bacteria. So by knowing that this principle, right, we have to practice simple woman hygiene. Basically, wear underwear with a cotton crotch. Avoid tight pantyhose, leggings, or jeans. Stay away from the vaginal douches. Don't use scented feminine products or toilet paper. And change tampon, liners, pad, and frequently. Change out of wet clothes as soon as possible. And after peeing, I always advise my female patient, always wipe from the front to the back. Because if you wipe from the back to the front, we're going to bring all the bad bacteria, dirty bacteria from the anus to the front to the vagina and urinary tract infection, right? So BV treatment, usually doctors tend to treat with the bacteria, with antibiotics. And definitely it doesn't respond to antifungal medication, just like what we mentioned about yeast infection, although the symptom almost similar. And those with the ongoing treatment with the symptomatic BV, they should be refrained from sex until treatment is complete. If the partner is male, the partner doesn't need any treatment. But if the partner is female, then she may have a BV as well and should see a doctor too. Now, that is antibiotic treatment and prevention. Another school of thought saying that since it's the off balance of the good bacteria and bad bacteria, we should not just purely focus on antibiotic. We should grow back the normal flora. Now, as you can see here, this is a normal healthy vagina canal with a good vaginal epithelial lining at the bottom there, now overlaying by the superficial squamous flat cells and covered by a mucosa over the epithelial cells. And this is where lactobacillus stay and grow healthily and protect the defense system or immune system and keep it healthy, right? On top of that, there's organic acid, anterior bacterial peptide, and also the bacteriocin as a soldier to protect from the attacking bacteria. And the normal pH for a healthy vagina is 3.5 to 4.4, right? So if there's a bad bacteria come in, as you can see the black dot there, pathogen, right? Then there are few mechanisms here will kill off it. The organic acid, antibacterial peptides, and also bacteriocin will kill off the bacteria. And on top of that, there is a so-called TLK receptor where they will absorb and hang to the bad bacteria and send out some macrophage, all the white blood cells, to eat up and kill off all the bacteria. So with this system, we call it innate immunity. Together with lactobacillus, it protects the healthy environment of the vagina and it won't cause much problem. Right? That's important of lactobacillus here. And also the TLK receptor. But somehow, they argue that this second school of thought say that if you were to treat bacterial vaginosis with antibiotic, with disinfectant, traditional medicine or herbs, cheap colloid, irritant surfactants, chlorhexidine, then it not only, of course, with that, you kill off the bacteria, but also you kill off the good lactobacillus as well. And along the way, you damage the healthy cell lining in the vagina. And that is the problem. That caused, this is exactly what happened when there is a bacterial vaginosis. Right? So there's still argument. So there are some people advocate that don't use antibiotic, but build back the good vagina flora, which is lactobacillus. That's why in the market there are few products talk about how to build back the normal flora. That one I will leave it for any patient, any person with this problem to consult their gynecologist. And again, thank you for watching, and it's coincide with the International Day for Women Health. Thank you very much.